My name is Dominic Stipulkowski, and this is my presentation on why safe consumption sites should be created and implemented. First off, what are safe consumption sites? Safe consumption sites are places where you're able to bring your own drugs to be used in front of trained staff. Many services are offered in these sites, such as drug checking, testing for infectious diseases such as hepatitis C and HIV, and the use of clean equipment. In theory, these consumption sites should create a safer experience for drug use as it lowers the risk for an accidental overdose and ensures the use of clean equipment. Any medical concerns would be dealt with by a professional on site. With drug-related deaths on the rise in the early 2000s, the government sought a method to which could lower these numbers. A safe consumption site was opened in 2003 in Vancouver to attempt to control the drug use and supply in the city. There's evidence to show that this was effective, according to a study done by the University of Victoria. We see that there was a decrease of 28% in intoxicated people in public. Also, with the opening of the site, there was no increase in the drug use rate in the city. Another reason why safe consumption sites are good is that it will increase the morale and happiness of the community. Since less people are found in public intoxicated, this makes the community overall seem cleaner. According to a journal written by Yoon, surveys were done by people who worked and used these sites and found participants liked the privacy they got using these sites and reported it keeps their dignity while using these drugs. There was also social cohesion in these sites between workers to users and users to users. This created a sense of community in the site and eliminated some stigmas. We can also see that safe consumption sites increase the safety amongst drug users. In a journal written by Barrot Lambdin, we see that there is a decrease in emergency room visits amongst those who use the safe consumption sites. This is due to the amount of safety measures used, such as drug testing and having professionals on site. During the 12-month period of those who regularly use the site, they recorded 13 deaths out of the 800 people who used it. However, none of these deaths happened to those using the site at the time. A journal written by Kral writes about a site that reported 10,514 injections and 33 overdoses in a 5-year span. However, they reported 0 deaths as they were treated by medical professionals on site preventing death. This shows a lot of improvement from the reported 70,000 overdose deaths that happen in the United States every year. This also shows that the safety measures taken by these sites are proving to be effective. These sites are also a more structured environment with rules in place to prevent any foul play. A journal written by Davidson talks about how a site changed a 30-minute time limit at each table to unlimited as they found it didn't take 30 minutes for people to finish using it, and instead use the rest of the time to organize their bags. They would change this to they would only have to leave if the table was needed by someone else. These rules are also suggested by the staff that are working at these sites. This provides some authority in the place, and it comes with some added safety for everyone. In conclusion, safe consumption sites provide the government control of the drug supply, it increases community morale, increases drug use safety, and provides a more structured environment for those using it, which is why I think these sites should be created and implemented.